My name is Robert Bache, Medicare Bob. I own Senior Healthcare Direct, and I help people nationwide with their Medicare insurance. Well, I got great news for you. We're having a first look, a sneak peek at the 2020 Medicare Part D information. We've heard since Obamacare passed, the coverage gap or donut hole is going to be going away. So I'm excited to show you the results of that. If you follow me on YouTube or Facebook, I do videos on Medicare Part D every year. You know that there's 4 levels to every drug plan. There typically, unless there's no deductible. But for most drug plans, the ones that have deductible, there's 4 levels. So the first level is the deductible level. The second level is initial coverage level. Third is donut hole or coverage gap. And number 4 is the catastrophic coverage. If the plan doesn't have a deductible, then it just picks up right at initial coverage level and has 3 levels. So I'm excited to show you what 2020 is going to look like. It looks like the deductible for 2020 is going to be $435. Now, some of you have what's called a tiered deductible, meaning if you take a generic prescription, like a tier 1, which is a preferred generic, or a tier 2, which is non-preferred generic, the deductible does not apply. So those will most likely still be either $1 or $4. But for non-generics, or if your plan has a standard deductible, it's going to be $435. Now, to go to the second level, or if your plan doesn't have a deductible, you start at the initial coverage level. I call this the copay level. Well, it's really cool because once you meet your deductible, if your plan doesn't have one, you just have to pay 25% of your prescription drug costs. Now, the company's still going to get their negotiated price, so you just have to pay 25% of their negotiated price. Now, once you reach $4,020, you go to the third level, but here's the good news. The donut hole doesn't exist anymore. So you actually stay technically at that 25% of your costs for the prescription drug for next year, for the first time ever. So that's really cool. So the donut hole is gone. Now we can put a mini donut in the donut hole, and now we got a whole donut, I don't know, or a Boston cream. But there's no more donut hole, okay? So you're gonna pay 25% of the drug costs while you're in the initial coverage level, and technically in the coverage gap, which doesn't exist anymore, you're still paying 25%, as you can see. Now, once your drug costs and the insurance company's costs reach $6,350, you enter the fourth level, which is called the catastrophic level. That's where the government kind of steps in and pays 95%, and you have to pay 5% of your cost. So the 4 levels technically are, the donut hole's gone. So it's going to be 25% while you're in that initial coverage level, or in the donut hole now, the third level, the coverage gap. It doesn't exist. It's 25% the whole time until you reach just over $6,300, and then Medicare steps in, pays 95%, and you pay 5%. Now, the actual plans have not been released yet, but as soon as I get those, I'll be happy to share those with you. If you have any question about anything to do with Medicare, just give the phone number on the screen a call, and my agents and I will be happy to help you.